Hi everybody. I'm just waiting for Ansuman to join me now. Let's see if he will. Hope everybody is well. Wave. Hi everyone. How's everyone doing? How's everyone's day been? So Ansuman is going to join me. We've talked about this, but I'm just gonna wait until he's actually requested. Now we're trying to work out this Instagram live thing. Just hang on. Yes, so view request. Bit more smoother, hopefully, than last time. Let's have a look. Accept. Hello.
Hi, Zainab.
Yeah, hi. Are you using it on your phone or your laptop this time? Can you
No,
see me
no,
this time?
I'm using my phone.
Okay, so you can see me this time, yeah?
Yes, I can.
Oh, how are you? How's your day been?
Yeah, my day was good. Actually, my day was very good. Uh,
Fantastic. And were
mm,
you at work today? Were you working or did you have?
no, I was off. I was off, and so morning was like usual, hitting the gym and back, and then in the afternoon there was I went to Presterton. So
Oh, fantastic. Okay.
mm,
Is that quite
yeah,
far from Stoke? Because that's where.
uh, it's um, it's 90 minutes, so and not that far. Like
Okay.
if you want to be there,
Yeah.
like yeah, if you don't want to be there, then half an hour seems very far. So
Yeah.
yeah,
Oh,
so
well, thank you so much. I mean, we are doing this live today about the DRCOG,
yeah,
which is the exam I sat in April.
yeah.
And you said you wanted to ask some questions about it because you were maybe thinking
Yes,
about doing it.
yeah. So before we go to that, I I know people know you, but
Yeah.
I think a little bit of introduction would be good.
Okay.
Um, so Zainab, we know you as you qualified as a GP, I think a year or two before we did. So that was, I think, 2017, 18,
18. Yeah.
18. Yeah,
Yeah.
and since then you started working as a salaried GP.
That's right. So I mean, I trained for 6 years. You know, normally GP training is 3 years, but because I had two children during training and there was less than full time as well, it went on 6 years, 6 and a bit years actually, because I qualified in November 18. And then as soon as my job finished as a trainee, the following week I was at my salary job, and I also do out of hours as well. So I'd applied for that during my application for the salaried. So it's quite a nice mixture doing salaried and out of hours as well. And that's what I've been doing. But obviously I've been on maternity leave for the last year because of I've had the baby and I've just had this time off, and that's where I did this exam. And yeah, and we've been in touch about it, so that's why we're doing this live today.
So which one did you do you enjoy more, salaried or the out of
Out of
hours?
hours. You know what? I think they actually complement each other. So out of hours makes you see a lot more acute patients. It's a bit like doing the CSA again. You know, you don't have much information, and the patients are you don't know them. You don't have their past medical history. So it's quite nice to see patients that are not at your practice as well. It keeps you on your toes. I think it makes me a better in-house GP because I know what out of hour GPs deal with, and then it makes me a better out of hours GP because I know what in-house GPs complain about sometimes. Oh, they haven't written the investigation they did, or they haven't written down this examination. So I feel like my documentation's better because of doing both. You
Yeah,
know, I
yeah,
think it's fantastic. I loved it as a trainee, and actually, I think that's what helped me pass the CSA in the end.
yeah.
Yeah. Mm.
Okay. So uh, coming to that, so the DRCOG part. So when was the time first you decided to do your DRCOG, and why is
Yeah.
that? Why did you choose that?
Well, I wanted to do it when 2019 April. That's when I was thinking of doing it. But then the pandemic hit, the exam got cancelled. I was refunded back the fee for it as well, and then they gave me first priority to do it in October. But obviously, I would have had my son then, so I thought I don't want a chance taking it in the October. I'll see how things are in the following April, and that's when I did it. But actually, the DRCOG, you can do it from F2 onwards. It's the second year of post qualification. And you can be any specialty really, because you don't need to
Hmm.
have had obs and gynae experience to do it.
Oh, I did not know that. So,
Yeah.
uh, so did you consider doing anything else apart from DRCOG, or
I know you
was
can do
it
the
always?
family planning and things like, but to be fair, I mean, during the pandemic, there was very minimal patient contact. And this exam has no patient contact, it's just a paper exam. So I think that's what appealed to me more, purely for that reason, that I could show my interest in obs and gynae issues without having the issue of face-to-face contact at that time. So that's why I did it.
Hmm.
Mm.
Okay. Okay. So, did you have do you have any plan that after doing the HCOG, this is how you would like to apply that?
Yeah, so I mean, obviously now that I've got it, I feel like it does display that this does display interest and my, knowledge in the subject area. But I guess it is a foundation for further courses like the family planning course, or if I want to do coils, implants, it shows that I've got that added interest. But I think even day to day, it's very important because you see the population of our patients, women problems, periods,
Yes.
or like, contraception. It's so important to know the ins and outs. And sometimes there's so much information out there, guidelines always changing, especially with the menopause and HRT. So I think it sets the foundation for that, and you can build on that knowledge even more in practice, based on the exam as well. So I think it will help me develop my general practice as well.
Mm,
I don't feel as if I do definitely need to do anything extra. I
yeah.
could just work on what I know now. But we'll see what happens. I mean, I haven't gone back. I'll go back next week. So we'll see how I feel when I start seeing patients again.
Yeah, you must be excited to go back.
No, I am excited. I think this year has been long and
Yeah.
and fast at the same time. My son, he is a COVID baby. So as long as you're 2 meters away from him, he's fine. So I am worried about him when he goes to nursery, when the full 3 days. It's
Yeah.
going to be a challenge. Yeah.
So now this DRCOG that you said. So um, I agree with your like all these things help, like contraception, menopause, and all. And from my personal experience, what I saw is a lot of female patients, they prefer to talk about those with a female GP.
Yeah, absolutely.
A lot of times there are not enough female GPs in a surgeries, like say maybe four male GP and one female GP, and so sometimes they have to come to the male GP. But when the female GP is specially skilled like you, like more knowledgeable, then they would not choose to go to anyone else anyway.
Yeah,
So
yeah.
yes. So how did you prepare for DSCOG?
So the first thing I did, I looked on the website because the DRCOG website, the Royal College has their own specific area for it. So I went on there, I had a look at the syllabus, the format of the exam, and as I don't know if I met very much, I know a lot of people have done the exam because it's a very popular postgraduate exam, especially for GP trainees. That before it was a two paper 3 hour exam, and you'd go to a centre somewhere in the country and sit there and do it, but this time, because of the pandemic, they made it a 3 hour exam, but at a test center, like a person view test center, so on a computer. So that's where I found out from the online, and the actual website is very, very thorough. It goes through each module and exactly what they are expecting you to know knowledge wise. So even they've got 7 modules and they've bullet pointed specifically which conditions, so which STIs you need to know about, which other infections you need to know about, what subfertility issues you need to know. So yeah, it's very, very thorough. So I think that's a very good starting point, and that's where I started. I wrote down things I wasn't confident with, and then worked my way through them first. Go on. You're going to say
So
something.
yeah, I was thinking. So you looked up online, but
Yeah.
did you speak to anyone like apart from looking up online?
Not really. I know that there was quite a few Facebook threads about it on, the GP support group. I think someone mentioned, oh, is anyone thinking of doing the DRCOG? What you would recommend? So I did follow that thread, and they mentioned a book on there as well. I had the green one, which I've lent to somebody, but my sister-in-law's got the new edition. So
Okay.
this is the DRCOG revision guide. This is the newest one, 2019 print. I'll put the link for it in the description after the live. So if anyone wants to go, I mean, I bought mine on Amazon. It's about £45 paperback, £38 Kindle. So it was quite a good support. In, sometimes you don't want to be on the computer all the time. You want to look at a book and read,
Yeah,
read
yeah,
questions. So it's nice to have that. But
yeah,
past medicine for me was actually the online resource that I used. I
yes.
thought it was quite good.
So, past medicine is something that also we use extensively for
I
our
know, yeah,
AKT preparation and
yeah,
many other exams, which is affordable, which is a good
yeah,
question bank, and
yeah.
many of their answers are very, very good.
That's what I
So,
love about past medicine, because it not only explains why the answer is what it is, but also then reminds you of that topic and says, like say for example PCOS, then it just repeats that topic summary, and then you just kind of reinforce the knowledge that way. But this book was quite good as well, because it was a mixture. It does go through in modules, and it's got 2 papers in the back of it to go through, like an exam mode. Um,
so how much was the past medicine?
So past medicine, from what I remember now, it's been a long time now. It's been like over a year. I think it was about £25 for past
Yeah.
medicine. It sounds about that. For 6 months, I took it for. I bought it for 6 months, but I didn't use
Okay.
it for 6 months. Maybe used it
Yeah.
for about a
Yeah.
month and a half or something.
And how much is the exam fee?
Exam fees about £400.
So all in all, £45 for the book, 25 approximately for the past
Mm,
medicine.
yeah,
So that's £70, yeah, and
yeah,
400. So it's all within £500 if you can do it in one attempt.
yeah. But you have 5 attempts to do it, and if you do fail, you can't get your money back. But it's not that it is. I mean, it's like any exam, you should prepare well. Even though I know a lot of people
Yeah,
say it's quite an easy exam, you still need to prepare well, and especially contraception. That comes up a lot, especially
mm,
for us, because it's targeted at GP trainees and
yeah,
GPs. So menopause, postnatal, all these things are
yes,
and past medicine's amazing for that, because I found that the questions on that were repeating the same theme, but would change in little details. So it would test whether you've recognized that detail would change your management in the end. So it's recognizing the patterns that they want you to for the exam.
um, yeah. So that input should be very helpful for the people, for our colleagues who want to do it. Now,
Yeah.
I have not, I might have missed if you already mentioned it, but
Mm.
what is the exam format like?
So it's it's a basic single best answer, 5 options, and that's it really. 120 questions, and that's it. I mean, the way I know they say it's 3 hours, the exam's three
Hmm.
hours, but when you're at the Person View Test Centre, I mean, I don't know if I'm allowed to say this, but I did it quite quickly, and there wasn't any option. Like when you do the paper exam, the invigilators make sure that you're there till the end. There wasn't any invigilator there. You did the exam, you finished, you were able to leave early if you wanted to. So it is 3 hours, and you have those 3 hours to do it. But if you finish within, finish within 2 hours, you can leave.
Okay.
Yeah.
And do you think it is possible to finish within 2 hours if the preparation
Yeah,
is
I mean,
good?
it depends. Yeah, absolutely. I mean, I was doing, because obviously I've got 3 children. I was doing it when my son would go to sleep. My other 2 would go to, when they were all in bed, 9 o'clock, 9 till 11. I was literally doing questions the whole time. because I can't revise in the day at all. Literally, they are, you know, they consume me mentally, physically, emotionally. So then it's only 9 o'clock in the night that I have that time. So I did 2 to 3 hours every night, pretty much for about 7 weeks.
Okay.
And
Okay.
I did about, I could do, by the end of it, I could do about 300 questions in the evening. Like I could do 300 questions in one go.
Now, that brings me to this point. Like you mentioned, I know you have very adorable kids. Now, when I look at you, you come across as a super mom. Like, it's like you were a GP, you were a homemaker, you were bringing
You're
up
so sweet, Ansuman.
kids, and still you are adding feathers to your, uh, crown,
Hat.
and
Oh,
yes,
proud, even with
yes,
nicer.
super mom, you have a crown, and as far as I know, you're you are author now, co-author of a book to be
No,
published.
so basically I've done some illustrations for a consultant spinal surgeon. He asked me to do some illustrations for a chapter in a book about TB in the spine. It hasn't come out yet. We're
Yeah,
waiting for the publication. But yeah, so that's quite exciting, isn't it? I'm quite
yeah.
looking forward to seeing that in actual paper, paper.
So I will deviate a little from the exam thing. So what inspires you? Like you're doing so many things, like
You're so funny. It's
everything. So what inspires you to do? I'm sure
what
you are
inspires
not
me.
going to stop at DRCOG.
No, I
You
mean,
probably would do something more very soon.
I feel a bit bad. You're saying that, and I really appreciate it. I really do. But I don't feel as if I'm overly inspiring, to be honest. I mean, I when I started GP training, I didn't do anything extra in training because I had my son, I had loads of things going on. So I wanted to finish training as quickly as possible. But then I had my daughter, so that made it even longer. But I just wanted to finish training, and now that I've become a GP and been a GP for a while, now I feel inspired. To be fair. Uh, what actually inspires me, it's going to sound really cliche, but my parents, because they worked so hard to get me to where I am. And I feel as if my mum had this opportunity to do medicine and become a doctor, she would have done every single qualification under the sun, to be honest. She's really, really good like that. And I think that's what makes me feel like I'm not doing enough, but I am trying because I want to do it for her, but also for myself. I feel as if what I do for her makes me a better person as well. But that inspires me. I think after this, I might, I did the MRCP exam and I passed it, but then I didn't do it because I had the AKT and the CSA. So I was concentrating on that. Then the time went, children, all that. So maybe that's something else I want to do in the future because I do love medicine so much. But I have to admit to myself what is realistic for me to do. You have to have, whatever goals you have, you've got to have some realism in whether it's possible to achieve them with everything going on, because sometimes I find I do get stressed quite a bit or I get overwhelmed, so it's important to recognize when you're limited. Do you know what I mean?
Yes, yes, I do. I think I do. So the now coming back a little bit to the clinical part of our primary care. So what I find is it's in primary care, a lot of presentations are dysfunctional or irregular PV bleed.
Yeah.
So how do you think? And I think that forms a big portion of our female patients
Yeah.
presentation. So how do you think this DRCOG helps you to deal with those better? And also, do you have any plans to educate
Mhm.
your colleagues who are not that confident dealing with those?
Yeah, I mean, I totally understand why there would be not so much confidence because, I mean, us females are very complicated in how we present, and it definitely has improved my confidence, especially when it comes to dysfunctional bleeding or contraception, purely because it makes you have to recognize what red flags are, knowing what red flags are, when to refer. I think these are the kind of issue, knowing when the patient's in front of you, what plan you're going to have. I think that's where the exam is handy, because it makes you feel less scared of dealing with that presenting complaint. I've just seen on here, just on the chat, says
Yes.
Kuramaz has asked what topics occurred and what was a high yield question. What were the high yield questions? So in terms of topics, you've got obviously everything to do with fertility, subfertility, sexually transmitted infections, so gum clinic type stuff. You also have the pregnant woman, postmenopause, postnatal, and then you've got urgent and non-urgent gynecological presentations as well. So quite a few things to go through. And you do need to know a little bit about the neonate and what happens, the APGAR score and the Bishop score and all that kind of stuff too. There's quite a few detailed stuff within the pregnancy and the labour that you need to know about as well, which obviously you don't do in general practice, but it's a specialist exam, so they need to have that. And the pass mark, I think this time was 66 or something. So that's around about kind of what the exam pass mark is like. Yeah.
Okay. So does it change?
Not significantly. As far as I'm aware, it stays around the 66, 68 pass mark. And
Okay.
yeah, so it's quite a high. You need to, pass quite good really to pass it. Yeah.
Yes. So you are getting
well.
You're getting a diploma, so you have to do that. And I guess what you were telling us so far, that you need to prepare well.
Yeah. I even though it's an easy exam, a lot of people say, oh, it's an easy exam, and yeah, you can pass it, and that's fine. But I know people who have failed it, because they haven't prepared or they've underestimated the knowledge. And the high yield questions, I mean, there was a lot of contraception, lots. I think if you know contraception like the back of your hand, you've got so many marks under your belt. So that I think, and that's helped me, because I really kind of dread sometimes some of the contraception questions, patients come in, or HRT. My goodness, HRT was menopause, and there's so many different treatments, and
Yes.
so yeah. Oh, Shavana just said, what's the best resources? Well, I mentioned the book, which I hold up again. This is the latest version. I had the green one, but this is my sister-in-law's one. There's also...
Can you hold up
Sorry.
again? So it says the DRCOG revision guide.
Yeah, is the third edition, so 2019 publication.
And
There's
that is
also
£45.
£45, and also it might have changed for this one. I don't know if the green one was 45. There's also the green top guidelines on the RCOG website. So they, if you're not confident with a topic, or not sure about a topic, because I wasn't really sure about placenta accreta, or accreta, that sometimes they say that it is, where the placenta actually sticks to the uterus, and and I went on the guidelines and I had a good read. It gives you a nice summary of the condition, so that's really good. The green top guidelines are excellent, but I wouldn't recommend reading every single one, because you'd be there for days. Just read the things that you feel you're not confident with, or you're not, don't know much about a topic or something.
Yeah. Okay. Do we? So we have answered all the questions.
Yeah.
So is there any refresher, like, or is it like once you have done DRCOG, that's it?
Yeah, no, there's no refresher. Once you've done the DRCOG, you've got it. I think some people do sign up to the RCOG. They sign up and subscribe to them. I haven't done that, so maybe I've got to add the date the year that I passed it. It's a bit like when you leave, RCGP, for example. You don't have to be part of the college to be a GP, but you just have to make sure you put your date on there. Hi, Samira. She said hi.
Yeah.
So
yeah. Any connection of DRCOG with the FRCOG?
There's no direct connection. You can do that diploma without doing the DRCOG, but obviously it gives you the foundation and it shows that you've got interest. And I think before I was really I really didn't like women's health that much. it sounds a bit strange, but I was more into like cardiology or diabetes or, you know, doing more chronic diseases. And
Yeah.
it always used to like make me feel uncomfortable, you know. But when I did the obs and gynae rotation as a GP trainee, I absolutely loved it. It made sense to me. And I actually feel like I can do a speculum with my eyes closed now. You know what I mean? It's like that
Yeah.
fear is gone. That fear is gone
That's
of
that's really
yeah.
something, because what we feel as male GPs, because female patients generally prefer to go to female GPs, our
Yeah.
exposure is less, and then
Yeah.
not having a gynae obs rotation, it's the,
I don't know how
it
people
becomes
do it.
difficult.
You know
Yeah,
what? I feel so lucky because I had pediatrics, I had GP, obviously GP, palliative care, pediatrics, and obs and gynae and A&E.
yeah,
I mean,
yeah,
I feel like they were the best rotations for me because now I'm so
yeah,
much more confident, you know,
yeah,
examining children. And when it comes to female patients, the speculum, I mean, almost, even though I did the DRC, obs and gynae rotation, it didn't make me more knowledgeable for my GP practice. What it helped me was with dealing with you know, how to approach the examination, for example, or how, because it's quite an intimate examination, the
yeah,
speculum, and also it helped me know what to refer into obs and gynae. That's what it helped me with. But with the day-to-day, that no one
yeah.
came to see you about contraception in obs and gynae. It was more acute stuff and ectopic pregnancies and stuff.
Yeah, I agree with pediatrics.
Yeah,
My doing pediatrics, it helped big time.
yeah.
But the problem is you can only choose limited number.
Mm,
So I feel if they had a combined small rotation, like
yeah.
if you could rotate like 3 weeks each in ophthalmology, ENT,
Mm, yeah,
those kind of things, and then
yeah,
maybe big rotation of a couple of months with obs, gynae, pediatrics, that kind of thing. But you have two questions there.
yeah.
One was how many questions do you recommend to go through
Oh
every day?
God.
You already
You know
answered
what?
that, 300.
Yeah, Shavana, you know me. If I, you know, when I did the MRCP, I did basically 1,000 questions a day. Like I will do as many questions as I can because a lot of people say, "Oh, do 50 questions here and there." Do what you can because time is limited. For me, time is limited because the way when the baby wakes up, there's no going back. I can't go back to the book after that. You know, you've got they're basically, you know, they're my priority, really, isn't it? So I think do what you can. If your stamina says do 100, do 100, 200, 200, 300. I mean, I got to 300 per session per 2-3 hours, but that's because I did it so many times. I think I went through past medicine quite a few times.
I, I what I'd like to say is, I think discounting number of questions
Yeah,
does not mean anything, because
yeah,
it depends on the quality also. So if you
absolutely.
can balance, like doing 300 without much quality, just trying to memorize would not help. It's
Yeah,
similar with AKT. So you need to put in significant number, but it
yeah,
doesn't matter whether it is 100 or 150, as long as you
yeah.
can cover. So
Exactly.
yeah.
But let me just, a little disclaimer. I was only doing 300 when I'd already done the topics and I was just jogging my memory. But you know, imagine, like, you know, you're absolutely right. If you just did it for memory, because obviously the questions repeat, and if you did it like that, then you wouldn't be challenging yourself. You just be, because you're not going to get those questions in the exam. And I guess you may not pass at the end. Kuram has asked, would you recommend
Yeah.
is doing an obs and gynae rotation? Yeah, I definitely would recommend. I mean, I know some places don't offer obs and gynae, which I don't know why, because I think we're quite a big asset to the team. I think we add a lot of value to the team as well. And how does it help? It definitely helps. You know what it helps with more with what you refer in to obs and gynae when you're a GP. You know what red flags are. You know what the kind of guidelines are there, or what they accept as a patient in their ward. Do you know what I'm saying? Like, you know, depending on their bloods or their presentation, OPV
Yeah.
bleeding, or so I think it's that's the kind of thing, because you don't see the run of the mill GP stuff there. You don't. You just
Yeah.
see all the acute stuff.
But I want to add something to this. Is uh, you can, as I said, you can only do certain number of rotations. So
Yeah, I know. Yeah,
rest of the things you learn on the job, like when you were a GP, like those who have not done psych, they can
yeah,
learn that there. Also, if you are keen and you are getting enough patients, then you can slowly pick up the gynae through guidelines and doing it. But of
yeah,
course, you have to know the basics, and we all know that, like,
yeah.
speculum, bimanual, all these things. But yeah, if in ideal world, we would love
You do
to
all the
do all
rotations.
rotations. Yes, that helps.
Yeah, I mean,
Definitely.
I didn't do ENT or ophthalmology, and my brother did ENT, and actually that's helped in his practice. He's gonna
Yeah,
hopefully be setting up a service here in his practice, being ENT specialist, and that's
yeah,
great. Like, it's still,
yeah,
I wish, sometimes I think, oh, if I did ENT, would I be inspired to do that? It makes you think that would you take a different turn in your career if you had that opportunity, but because you don't have that opportunity, you're not gonna
yeah.
see that chance. What do you
Zainab,
think? Yeah, go
Zainab,
on.
there are, I have heard some GP schemes where I think there are some places in London who offered this combination that I was talking about. So
Mm.
you do 15 days of ENT, 15 days of ophthalmology, 15 days of dermatology, that
Oh,
kind of
right,
thing.
okay.
So yeah, you can combine 3 or 4 and go through 2 months period where you have exposure to those. So you learn the basics. So,
Yeah.
but unfortunately, that's not everywhere. So.
Mm. And I know Kurum's other question was, you really need it when, do you really need it? I think I guess there are some people who haven't done an O&G rotation and they're still doing fine as a GP. It's not, I guess, when you've done it, you value it, oh my god, this was great. I've learned so much. But if you haven't, you still, like you said, you do learn on the job. And you have a lot of support in general practice from your colleagues and your trainer. So there is opportunity there to build on those skills. But you don't necessarily have to have done an O&G job to do the DRCOG, to be fair.
Yeah.
So that's quite good that you can
Mm.
show your interest that way.
Uh, Now, I know you have done the DSCG and you, of course, you spoke about it. Do you think there are other similar things that can be as good?
How do you mean, like
Y-
comparable to the DRCOG?
Yes.
Um, I mean, there's obviously like, you mean other specialties, or just the related to obs and gynae?
Yes. No, not obs and gynae. So there are other things you
Okay,
have
so
come
there's the
across
child
colleagues
health.
who are, yeah.
Yeah, there's the Diploma of Child Health, isn't there? There's also, you can have elderly care, like geriatric medicine as well. I'm sure you could do like cardiology, diabetes diplomas
Mm, mm.
as well. Trying to think now, there's quite a few out there, but that's why I think the world is your oyster. Once you become a doc, I think it's amazing. When you're a GP, you have so much available to you to pick and choose what you want to do.
And
It's fantastic.
and you
I've just
can
seen. Sorry, go on.
you can add something like,
Yeah,
because you
yeah,
have done DRCG, now you can go to do the child health also, like
yeah.
nothing
There's
is
no
restricting you. So there is a
no.
question, Kuram.
Aren't you worried that your colleagues will just dump all women's problems at your door? Now, that already happens. That already happens anyways. When you're a female, but that's fine. I mean,
Some,
I'm happy with that, because in some ways, because I sometimes feel comfortable as a patient going to a female GP. You know what I mean? If it's about a woman problem, I wouldn't feel that comfortable. I mean, obviously I know that, they're going to treat you the same and all this, but it is that comfortability factor. Uh, and I don't blame them for that.
um,
And but there are
yeah,
only certain slots in my
yeah.
surgery, so if they can't book in, they can't book in. So they can't all dump everything.
You, I don't think we feel the dump at all, because we all are strong in certain areas and have weaknesses in certain areas.
Yeah,
And I think many of the practices, in my practice, there is open door policy. So if I'm not confident in something, just go next door, ask the GP, do you want to have a look? Or what do you think about this? So
mm.
I don't think there is, when someone starts working as a GP, we don't feel like something is being dumped on us. So,
No, absolutely.
no, yeah,
Yeah, and I think when you most mentioned about weaknesses and things, that's where I felt my weakness was the women's health bit. Even though I know I'm a woman, I should know
yeah,
everything to do with women's health, but it just, to me, because I wasn't that interested, I suppose, it made it harder for me to deal with it. And so
Yeah,
I thought, no, I'm going to do it. So my maternity leave has not been wasted. I've done the exam and I'm really happy and I feel more confident. When I go back, I'll definitely have something to add to the practice, especially with women's health, I suppose. And I might do some more stuff,
which is
but
great, which is
which is,
great.
which
Yeah.
we'll see what happens.
You already, I think, added a lot of values because I watched some videos about smoking cessation.
Yeah, yeah,
Yes, so you already
thank you.
do a lot of things. So I'm sure that you will keep on adding those. Yeah.
Yeah, and I do encourage others to like not give up on any of it. If you don't pass the exam, just do it again. It's not gonna, it's worth it in the end when you have that qualification and your knowledge improves. And you fail, I guess it's like the first attempt in learning, they call it, isn't it? FAIL. So go for it.
Yeah.
Yeah.
Do you suggest after one does the DRCOG, then regular, updating the, guideline and all, like
I
every?
suppose like everything. I mean, the Red Whale group, they do really good updates, don't they? And I tend to try and go on one of them every year. And they do mention women's health stuff every single year anyways.
Mm-hmm.
And that's quite good. Yeah, no, because things change all the time. I mean, especially now with COVID and so much has changed with that. It's really important to keep on top, not to like just do the exam and leave it. It is just building on your learning. It's important.
Okay. Okay.
Yeah, I hope that's helped everyone because I'm just, obviously this will be saved and I'll put the link for the book in the description. So if people want to buy it, I got mine on Amazon, second, Prime, so it came the next day. And it was like a birthday present for me. So that was quite nice. And that
Yeah.
did help. But yeah, remember Green Top Guidelines, this book, Past Medicine. I just want to say one thing. I tried the BMJ on examination question bank as well. However, I did not feel that, I mean, I don't want to, if people have found that useful, that's great. This is just my own personal thing, but they only had 316 questions and there was a lot of anatomy stuff on there that wasn't really what the exam was about. And there's a lot of the explanations on BMJ on examination are not that good, I don't feel. I felt like they were very confusing for me. Whereas Past Medicine, it kind of talks my language in
Yeah.
some ways. Do you find that Past Medicine is quite simple, like, talks to you like, it makes more sense, doesn't it?
There is another question
Oh, is
before.
that? Oh,
Yeah.
I've already gone all the way down, sorry. Could you please list the 10 top topics to focus on? Kurum, are you thinking of doing the exam? Please answer. How is it going to help you? Let's see. Okay, so the top 10 topics, let me see now. There's quite a few. So definitely focus on contraception, 100%. A to Z of contraception. Do not leave any stone unturned on that. HRT as well. What else? STI, so the treatments of all the STIs. Subfertility. I think it's good to know the different values of, like, especially when it comes to sperm and stuff like that, just to know your values of what the motility should be, and what categorizes as azoospermia, for example. What else? I'm just trying to think. Ectopic pregnancies, presentations, all the different, like, acute pelvic pain. What else? I'm just trying to think now. Karim's asked me for 10, but there's like loads that you need to know everything about. What else? All the emergencies, so PB bleeding, your red flags, so your postmenopausal bleeding, for example, and what the first investigation would be. The thing that the exam does, they don't, just like AKT, they do what's the least likely diagnosis, or they'll say what's the most appropriate next investigation, and there'll be like 3 there that you'd be, oh, I do that, that, and that. But it's working out what's the next, really reading the questions properly and, making sure that you're picking out what they really want. Because I think there was one where they had a postmenopausal bleeding case and they said, what's the next most appropriate investigation? So they had endometrial biopsy or ultrasound. And you think, actually, you'd probably send them for them two together. So which one do you choose? And that was quite a conundrum for me. And I can't remember what I put now. But, it's...
Okay, sorry to interrupt. So you can't remember what you put in, but
No, you know what?
what do
It's
you
so weird.
think? But
What
what
I
do you
would have put,
think
what
would
I
be
think
the
I would
right
have
answer?
put, so the most, I probably would have said ultrasound first, because then you
Okay.
would want to know what the lining looks like before you did the endometrial biopsy. But in your head, you've already decided this is going to be possibly an endometrial cancer. They need a biopsy. We'll do the
Yeah.
endometrial biopsy.
Yeah.
So I think it's really important to really read the question, especially the end bit, very, very carefully, because then you don't want to miss that what they're asking, basically. Yeah.
Okay.
So yeah, and what else? The green top guidelines, don't overdo it on that. Anything else? Any other questions you want to ask? Anyone else have any questions about the exam? Because we probably will be going in a second.
Yeah, you I think you covered everything, and the whole uh, fee would be 400 plus 25 for 45. That's around 470 pounds of investment.
Yeah,
With a good preparation, you can have your DRCOG with 470 pounds.
yeah. It's pretty amazing, isn't it? It's really good. And you get a bit more knowledge as well. If you're not
Yeah.
confident with women's health, do it. Show that you're confident. You can do it. You know, we can all do it. All medics. I think it's a really good investment. Um, and then yeah, that's what I think.
Okay.
Oh, well, thank you for all those questions,
Yeah.
Ansuman. I think I've like really. I don't wonder what everyone's thinking now.
Yeah.
Kuram's asked quite a few questions. I don't know if he's going to
Yeah.
do the exam. Doesn't look like it.
Yeah.
And
But
other people.
I learned a lot from how you approached and how you thought about it and the exam. Yeah, very useful information.
Yeah,
And
thank you so much, and hopefully it's helped other people.
hopefully, yes. And I think those who would be watching would be inspired by looking at like how many things you juggled and successfully did. So
Oh, thank you.
it's not that you just did not do the exam only. So as we mentioned, kids and home and everything else. So
Yeah,
yeah,
but it shows it can be done if you put your heart into it.
yes, yes,
Anything's possible, isn't it?
anything is
I mean,
possible.
we're allowed to be lazy a little. We're allowed to be lazy as well. Don't say that we have to be like super people all the time.
Yeah,
It's good to have down times too.
yeah,
Yeah.
yeah.
Oh, well, I'll see. Well, we'll speak soon, anyways, and
Yes, yes,
we'll do another live. I'm not sure what we're going to do quite yet. We're going to have a chat about that, and if there's any
yes.
topics that people want us to talk about,
Yeah.
you know, whether there's an exam or whatever. Do you
Any,
have any
yeah.
suggestions? Someone?
Uh, we can talk about because you have done the DSCAG, we can talk a little about the topic I mentioned, which is very common presentation next time. A little bit of
Okay.
talking about dysfunctional bleeding or irregular bleeding.
Yeah, that's fine.
And the other thing we can do is maybe little bit of uh, how we do the warfarin dosing. A lot of surgeries they do INR and then come to the GP, sometimes on-call GP, sometimes a specific GP, like what would be the warfarin dose. So what should go into it, how you should approach it. We can talk
Mm.
about that. So those two things we can cover next in our next meeting.
Yeah, and just to mention, we got a message on the group saying that
Yeah.
there's a shortage of, test. Was it bottles or like?
Test tubes, yeah,
Yeah.
the bottles, yes.
Wow. So that's another issue, guys, that's going on in the medical world right now. No
Yeah,
blood tests, limited on storing, blood. That's crazy.
that's crazy,
So
yes.
yeah. Well, look after yourself, and someone, everybody who's
Yeah, and
joined,
you,
thank you so much for
yeah,
supporting us, and hopefully we'll be back soon talking about
yeah,
dysfunctional uterine bleeding, or a bit of contraception if you want. We'll see
yeah,
what the mood
yeah.
where the mood takes us.
Let's see if something is being asked. Yeah,
Oh, anticoagulation in community, excellent topic. Thanks. Yeah,
yeah,
so
yeah,
I think that would be really good, because I think
yeah,
Kuram deals with that with his patients when he discharges them. A lot of issues with
yeah,
warfarin and aspirin, clopidogrel, and all that kind of stuff as well.
yeah,
So,
yeah. We can
yeah.
do that, yes.
Okay.
Okay,
Thank you so much. Look after
yeah,
yourselves, everyone. Everyone, take care.
and
Bye. I'll
yeah,
try and save the
okay,
live now.
yeah.
Okay. Bye.
Bye, bye.
Bye. And now.